Now, to describe the current state of mental health services in most countries as deficient would be an understatement. In Africa, statistics indicate the psychiatrist-to-patient ratio is less than 1 to 100,000. Solomon Abo tells us more.
According to the World Health Organization, mental health in many African countries has grown from bad to worse. In some cases, the situation has been exacerbated due to armed conflict. Psychiatric-to-patient ratio is less than 1 to 100,000. Dr. Eko Asari, a native of Ghana, is a psychiatrist at the American College of Cardiology. She describes the situation as unfortunate.
It's tragic, and it's pitiful, and it is unnecessarily so. What you have is a situation where you already have strapped governments when it comes to economics, when it comes to just the infrastructure of the political movements there, right? So first of all, you have to understand that if your underlying foundation is not solid, then anything else that you add cannot be solid.
With limited accessibility to mental health facilities, mental health patients resort to traditional and faith healers for treatment. There are documented cases of mental health patients being isolated from their communities for a long period of time without adequate food or shelter. Dr. Asari says people need to change their attitude towards mental health patients.
Individuals who suffer from mental illnesses are people. You have got to get that in your psyche, in your soul, in your being. They're not dogs, they're not less than you. They are human beings. And you must treat them with the compassion and respect and care that they deserve.
Dr. Sari says for Africa countries to maximize on human productivity, mental health treatment must be paramount on the agenda.
The barometer of your country's health is not merely the absence of illness, but the presence of absolute wellness. And if you want to have a people who are thriving and who are given back into your economy, you have got to take into absolute consideration their mental health.
Given the steady rise in the number of mental health patients in Africa, governments need to put in place sound mental health care systems to cater for these most vulnerable members of the society. Solomon Abo, VOA News, Washington.
That's our Africa Health Report for today. Vincent?
Well, and thank you very much for joining us today, Lenore. Be sure to watch for Lenore Mudu every Tuesday and Thursday for the latest health news in Africa right here on Africa 54.